So this will be a presentation on the pectoralis major tear and the pectoralis major. So the pectoralis muscle is the large muscle in front of the chest wall or sternum. There are two parts, the pectoralis major and the minor. We're going to be focusing on the major, which is located anteriorly to the minor. It has the clavicular head, the sternocostal head, and the abdominal head. And then there's the clavicle and the sternum and the humerus as the bones. And the origin of the pectoralis major is on the anterior surface of the medial half of the clavicle, which is located right about here. And then you have the sternocostal head, which is on the anterior surface of the sternum, and the costal cartilages of ribs 1 to 6, right about here. And then you have the abdominal head, which is on the anterior layer of the rectus sheath. It inserts onto the crest of the greater tubercle of the humerus, which is right here. And the action of the pectoralis major is adduction and internal rotation of the arm at the shoulder joint. So what is a pectoral tear? The pectoralis major muscle, or more commonly the tendon of the pectoralis major that attaches to the humerus, can rupture, and this is the most common type of a pectoral tear, and it's more accurately called a pectoralis major muscle rupture. There are multiple types of these ruptures. So you have a type 1, which is a rupture at the humeral insertion, which is a tendon rupture from the bone over here on the humerus. You have a type 2, which is a rupture at the musculotendinous junction, which is a rupture in between the tendon and the muscle. But this is a little more uncommon than type 1, which is very common. And you have a type 3 rupture, which is a rupture of the muscle itself, or the muscle belly, just the pectoralis major itself. And it's very uncommon. And you have a type 4 muscle rupture, which is when the muscle is torn off the sternum bone, which is right about in here. So the prevalence of this injury is pectoralis major tears are fairly uncommon. I worked at a physical therapy clinic, and my PT said that she had only worked with one pectoralis tear in her entire career. She's been working for 20 plus years. But it is less uncommon than what many people believe. These injuries occur almost exclusively in men between the ages of 20 and 50. And though there are partial tears that occur, it is less common, and most pectoralis major ruptures are usually a complete rupture of the tendinous attachment of the muscle to the bone from pectear.com. And this common rupture is a type 1 rupture. So causes for these types of tears: a pectoralis major injury mainly occurs during forceful activities, and that almost half of all pectoralis major ruptures happen during weightlifting. This is most commonly seen during the bench press, because there's a lot of pushing and moving the weight upward. Other causes of a pectoralis major rupture include football, rugby, wrestling, or other traumatic incidents involving a pushing movement like the bench press. Steroid use can also weaken the tendon of the pectoralis major muscle and is thought to be a factor in a number of pectoral rupture injuries, but that's not always the case. There are plenty of people that have not done steroids who still get these injuries. So symptoms of the pectoralis major tear: you can have pain in the chest and the upper arm. You have loss of strength when pushing with upper extremities. There can be a tearing sound that can be heard at the time of the injury, and an injury in the muscle itself may sound like a towel ripping, while the tendon from the bone rupture makes more of a popping sound. You can have bruising in the chest and arm. Usually the bruise will spread as days go by. Dimpling or pocket form just above the armpit where the rupture occurred. You can have shoulder pain that can occur due to compensation of the pectoralis major not having full range of motion or strength, and pain is localized in the chest and the front of shoulder, but may radiate into the upper arm or neck that increases with activity. So a diagnosis for this is usually self-diagnosed, as the pain and bruising are generally consistent. A doctor visit may be required to evaluate what type and what the recommended plan for surgery will be. Doctors also diagnose pectoralis major injuries through a physical examination, as muscle bulk and shape and chest wall is visibly different on the injured side, as well as a bruising in the chest wall can be apparent. So treatments and surgical interventions of type 1 and type 2 pectoralis major ruptures. So surgery for a type 1 is recommended for complete tears of the muscle tendon. This can be done by repairing the torn tendon to the bone, and it's done by placing large sutures in the torn tendon and then securing these to the arm bone with holes in the bone or anchors inserted into the bone. That doesn't sound too fun. Type 2 rupture requires surgery through some surgeons like to operate immediately, and others would like to wait until the scar tissue consolidates. Some like to wait because the surgeon can reef or bind suture materials together while binding tissues in surgery. They can reef the muscle tendon junction with a special high-strength suture material that encourages healing. And this is because you cannot repair muscle directly, so it makes more sense to wait for fibrous tissue at either side to accumulate. So for type 3 and type 4 muscle ruptures, at type 3, they're not only extremely uncommon, but almost basically impossible to repair. You can kind of try it by reinforcing it with an Achilles tendon allograft, which is kind of cool, but most surgeons don't advise to operate on these injuries. And a type 4 pectoralis major tear is even more rare and is actually basically almost impossible to repair, as there's only muscle and no tendon at the sternum. This would leave an extremely large scar on the breast and is especially ill-advised for bodybuilders, so their career may already be over with this type of injury. So this is a bodybuilder who had a type 2 rupture. You can see kind of here he has some swelling and ecchymosis at the axilla. And the rupture did occur without any warming, even though he had adequate warm-up with no pain before the attempt of this bench press. And it was a pretty impressive bench press at 200 kg. He was only 27 years old. So for a bodybuilder, the cosmetic result is of prime importance, and the picture shown left is of another bodybuilder with a very similar injury 12 months after it was repaired. Though it looks nice cosmetically for a bodybuilder, it was not sufficient, and it did end his bodybuilder career. And this shows how detrimental a pectoral tear can be regarding a bodybuilding career. So now we'll get into a rehabilitation program for this. This is going to start, it's going to go 4 phases. So phase 1 is weeks 0 to 6. It's by Anthony Shepsis, MD. He's a director of sports medicine and professor of orthopedic surgery and has a rehab protocol for the repair of a pectoralis major tear. So phase 1 is 0 to 6 weeks. You have to immobilize to allow for the repair to heal. You have to have a sling and a swath at all times. You must ice compress continuously for 1 week and then regularly 20 minutes for 3 to 5 times per day as needed. At 4 weeks, you may start to get some movement, where you need to avoid abduction and external rotation until the 6th week. So this is phase 2, weeks 6 to 8. You can start with passive range of motion, initiate the forward flexion and internal rotation, and you can also initiate active assist and active motion activities, so like pendulums or active and passive forward flexion. You can start abduction with arms in internal rotation. You can start external rotation with arm adducted, but you should not couple these motions as it can really impact the repair time. And you will always have to have a crossbody sling to keep the arm at rest. So phase 3, this is weeks 8 to 12. So at 8 weeks, you can start isometrics of the pectoralis and other shoulder girdle muscles. At 10 weeks, you can couple the abduction and external rotation movements without any restrictions. And at 12 weeks, you can actually start light resistive exercise, which to me that sounds pretty quick. So phase 4, this is at 4 to 6 months. So at 4 months, you can initiate a heavy resistive strengthening program and prepare to return to contact sports or activities at 5 to 6 months. And you can even start heavy weightlifting at 6 months. Like this guy right here. He's got a pretty big bench press on there. Now we'll get into some prevention tips. So proper form is extremely important in preventing pectoralis major ruptures, especially just during the bench press. The most important considerations for this is to limit the distance of the bar lowered and to narrow the grip of the hands. It's because lowering the bar all the way to the chest and a wider grip put way more stress on the muscle, increasing your chance of injury. Stretching and proper warm-up is also extremely important, but as we saw with the case study, it's not a definite prevention tip, though it will help. So now we're going to do a video. This is kind of just a overview of the pectoralis major, and it's by Dr. Nabil Ibrahim. He's a professor and chairman at the Department of Orthopedic Surgery at the University of Toledo Medical Center.
I have it! Pectoralis major tear. Pectoralis major insertion is just lateral to the long head of the biceps. Here is the insertion of the tendons in the proximal part of the humerus. You can see medial to the biceps is the latissimus dorsi tendon insertion, and medial to the latissimus dorsi is the teres major muscle insertion. The subscapularis inserts superiorly on the lesser tuberosity medial to the biceps tendon. Pectoralis major tear usually occurs in young male weightlifters during bench pressing from eccentric contraction or lengthening of the muscle. Usually there is pain around the shoulder area and the patient will feel a pop in the shoulder while performing the bench press. There will be discoloration and burning over the pectoralis into the axilla. There will be swelling, ecchymosis, and palpable defect. The patient will have loss of contour of the axillary fold. MRI will confirm the diagnosis, will localize the site of the tear, and will also differentiate between partial and complete tear. Tendon avulsion is the most common type of injury to the pectoralis major muscle, and the tear is usually a complete tear. Hemorrhage and edema at the level of the proximal humeral shaft indicates a pectoralis major tendon rupture. Treatment. Early repair of the tendon should be done. Reinsert the involved tendon into the humeral shaft, lateral to the biceps tuberosity. Chronic tears will need tendon graft, a more complicated surgery. The tendon is usually retracted and the outcome is not as good as in case of acute repair. Thank you very much. I hope that was helpful.
All right, so that was just a little video for everyone to see, kind of mix up the video format and hopefully give you like another little overview of what we just went over. And then these are my sources that I've used in this video. And thank you.